Hi everyone, I am Stephanie with 9Health. All this month we're kind of introducing you to these screenings we have. You can now get your 9Health preventive screenings along with a COVID-19 antibody test. We've partnered with Quest Diagnostics to make this possible. Normally you get those screenings at a 9Health fair, but we didn't have those this year. So now you can get them at Quest Diagnostics, but obviously something new is the COVID-19 antibody test because we are in this world of COVID-19. I'm joined by Marla Rodriguez. She's with 9Health and also 9Health expert Dr. Paul Coley. Marla recently got the antibody test done. I haven't gotten any of mine done yet, so I wanted to talk to her about what the experience was like, and then we can further answer any questions because this whole antibody test thing is pretty confusing, and I feel like we see news all the time that kind of contradicts itself. So it's always good to just kind of clear it up and talk about it. And if you have any questions about the other screenings we're offering, you can ask those as well. So post those in the comments and I'll get those answered by Marla and Dr. Coley. But first, Marla, first just talk about the antibody test. You got yours done. What was your experience like and why did you want to get tested?
Well, first, let me just say I'm paranoid. And so I thought I had COVID at least 4 times before I actually knew anything. So when the antibody test became available, I was the first in line, right? Because I wanted to know, did I really have a COVID? Because I have a little bit of asthma. And so I had tightness of my chest and shortness of breath. And, I even, according to me, had a little bit of a fever. So back in, April. And so I thought for sure this is COVID. And so that happened about 4 times. So I wanted to go see if it really was COVID or if it was something else. And so I went and got tested. I actually, here's a spoiler alert, I was negative. So I did not have COVID 4 times.
Or not even once.
Not even once.
Or at least didn't have anything that mounted an antibody response. Because there is,
true.
I mean, we heard early on, a lot of people are asymptomatic. So I think that's part of it too, is it's like, well, I didn't have any symptoms, but maybe I had it. Maybe I need to go get tested and see if I have the antibodies. We already have a question, Dr. Coley, that I'd like you to answer. Someone said they have the antibodies. What's the latest about what that means in terms of protection or the ability to still spread the virus? And maybe you can talk about too, what else people can do if they test positive.
That's a really important question. And actually 2 new studies just came out this week, exactly to the point you were making, Stephanie, which is that number 1, the antibody response may be directly proportional to how severe your illness was. So those of us that have asymptomatic COVID-19 may not mount that aggressive antibody response. In fact, the studies have shown that out of 100 people infected with COVID-19, about 70 of them mount a strong antibody response, about 25 of them mount a weak antibody response. And there's about 5% of people that may not mount an antibody response at all. So if you have a positive COVID antibody, you're lucky. That's a good sign that your immune system saw the infection and mounted an antibody response, at least a minimum amount to trigger a positive test. But what that actually means for you is still a little bit up in the air, because just this week we had 2 new studies that showed us that antibodies can quickly wane or go down after infection. So we know from other coronaviruses that antibodies against coronaviruses usually last about 1 to 3 years. So it's not necessarily like a measles antibody that's going to last you for the rest of your life. And it's probably not just going to last for a few weeks. But these studies suggest that it may last as short as a few weeks, maybe even just a month. Having said that, I will say that if that really was the case, that the antibodies were only lasting for a month and you were still at risk for getting infected again, we would see a lot more reinfection around the world than we're actually seeing. We're not hearing about a lot of reinfection outside of these small anecdotal stories here and there, but it's not that large populations or cities like New York are having a big wave of reinfections within the same number of people. So I do think the antibody probably confers some degree of protection, but I'm going to put a huge caveat on that, which is that we just don't know. So it's not safe for you to assume that you're protected from reinfection, because we have seen some cases. It's not safe for you to stop wearing a mask or doing social distancing, because you could still potentially bring the infection to others. And we don't know if you have enough of the antibodies. We don't know how long they're going to last. And we also don't know if they're the right type. So there's just a lot of unknowns out there. So positive antibody response makes you a potential candidate for donating your plasma to somebody who's sick. It tells you that you've seen the infection yourself, but it doesn't give you an immunity passport, and you still need to be extremely cautious.
Talking a little bit more about the plasma, what do we know? Because we were even talking about this yesterday just amongst ourselves. Are there still studies that show that it benefits those that are sick? What is the latest on that?
So in terms of treatments, what we really determined is that remdesivir shortens the duration of hospitalization. Hydroxychloroquine does not seem to have a significant benefit. And steroids, actually in people who are critically ill, are showing to have the biggest or best benefit. Dexamethasone leads to a mortality benefit. Now in the sickest patients, we are still using convalescent plasma or convalescent serum, which is this antibody treatment. But in the clinical trials yet, it has not proven definitive benefit. What it's shown is that it's trending towards a positive benefit, but statistically it wasn't significant. So it's not clear whether we just needed more people in the trial to have statistical power to detect the difference, or whether the difference is so small that it's just not really panning out statistically. But regardless, as physicians, we are using it in some of the sickest patients because it really doesn't seem to have that many adverse effects, and it may have some benefits. So if you are potentially a donor, there are a lot of studies ongoing right now. Please do go and donate your plasma because that could help somebody else.
Yeah, when we talked about it before too, it was also that, these studies just need people that have had the infection and, to donate so they can further study this. So it is just a benefit to the science community to donate your plasma as well, so we can just figure out more. Because I think that's part of the frustration is this is all very new. We're all still learning. So we might hear something one day and then the next day it's different. And that's kind of just how it's been. So it is pretty frustrating, but we're trying to navigate it best we can. Marla, you talked about your test being negative. You thought you had COVID 4 times, but no times, turns out. Talk a little bit more about just the experience. So you went, it's a blood test. Talk a little bit about the experience and what people can expect when they go.
Yeah, it was pretty easy. I signed up at 9healthfair.org to get to register, and the test only costs $79, and I just went ahead and entered my credit card, and then I had to make an appointment at a Quest Diagnostics Patient Service Center, and there happened to be one really close to me, so I just went on and made an appointment there. There was an appointment, I think, within a week, and I was able to go ahead and make the appointment, and then I got a QR code, which I'm not really very good at QR codes, but I was like, okay, I'll try it. And so I went there, and it was on my phone. And so when I got to Quest, it was super easy. I went in and they have a kiosk, you register, and they want your QR code. So you just put your phone next to the kiosk and boom, they know who you are and they've got your registration. And it said I could even go sit in my car and wait, but there wasn't really anybody in the waiting room. So I just kind of stood in the hall for a minute, and then they came and got me. And again, it was super easy. It was a blood draw, took probably 15 minutes. There was only one person, which was the phlebotomist in there taking my blood. And then obviously she was, wearing a mask and had gloves on. It was all safe. And then I left. So it was really, really easy actually to get the test.
Yeah, and I went live last week from a Quest Patient Service Center just to show people what it looked like. And you wear your mask. They had all the chairs spaced out 6 feet, little dots on the floor. When you, Marla talked about that kiosk where you check in, the dots were on the floor where you go to check in. So, and there wasn't really anyone in there when I was in there. I think probably because I was doing a Facebook Live, but it was still pretty quiet, still pretty slow, and they were very good about spacing things out. So I think that helps. And again, you can go to 9healthfair.org and learn more about that. Yeah, Dr. Coley.
I wanted to make a comment on Marla, even though we're laughing about the fact that she thought she had COVID 4 times, but she's actually the perfect person for whom this type of test is indicated. So it's really indicated if you think you may have had the infection, if you think you may have had symptoms. And what's really unusual about this virus, as we're all learning, is that the range of symptoms from asymptomatic to critically ill, it's so wide. And so it's hard to know sometimes whether or not we were infected. One thing I will point out is that you need to wait probably at least 2 weeks after your potential perception of your last symptoms before you go and get checked. Because unlike the nasal swab, which is a test in real time that tells you if you're actively infected with the virus, this test looks back and tells you if you've seen the virus before, but it usually takes about 2 weeks or so for your body to make enough antibodies if you were infected. So let's say you had symptoms today, you wouldn't want to go and get your test tomorrow or later this week. You would want to wait at least 2 weeks to go and get this antibody test before you'd know whether or not you may have been exposed to the virus.
And someone did say on Facebook, Marianne said she had all the symptoms in late December. Was that really COVID-19? Maybe go over the symptoms again and talk about, that does help I think I have a question here asking about accuracy. That does kind of help the accuracy as well, right? If you are someone who actually had symptoms or were exposed, then it's more likely that your positive is a true positive. if you get
You're absolutely right. So December is a little bit early. We think the earliest the virus may have been here in the United States was probably January. But again, it's very possible that it was here earlier than we realized. So it is possible that your symptoms in December could be reflective of this virus. And the nice thing about the antibody test, at least we think the antibodies, again, based on other coronaviruses, will stay positive for at least a year to 3 years. So probably they would still be positive, 8 months later, even though you had your symptoms in December. The CDC just released this week that the top 3 symptoms that they're seeing occur most commonly with this are fever, cough, and shortness of breath. Those are the 3 that we started with. But remember, they've added a whole bunch of new symptoms to the list, including headache, loss of taste or smell, muscle aches, sore throat, runny nose, sneezing has even been added to the list. So it really can be a wide variety of symptoms, any kind of symptoms that reflect immune activation, feeling fatigued, feeling run down, all of those could be symptoms consistent with COVID-19. So if you had symptoms in December, you may be a good candidate to have your blood test done now. And to the point that Stephanie just made, the accuracy of the test is not just a function of the test itself, because the test has certain characteristics, but it's actually also a function of who you're testing, so the population that you're testing. So if the test, which is actually a very good test, it has 90% sensitivity and 99% specificity. So it's a pretty good test by itself. But if you test it in a very low risk population, such as somebody who never had any symptoms, never had any exposure, never left their house, it doesn't perform as well as if you test it in a moderate to high risk population, such as those people who either had symptoms or had exposures or have other reasons to think that they may have been infected with COVID-19. So, you want to try to get the test only if you think you've had symptoms. Now, someone may be asking me, what if I was one of those asymptomatic people? Should I get the test to try to figure out if I was asymptomatic? And that's a really difficult question to answer because, if the test comes back positive and you had absolutely no symptoms, what I'm likely going to recommend as a provider is that you repeat the test to make sure that it's not a false positive, because it is possible you could have been asymptomatic and had the antibody response, but it's also possible that this could be a false positive. So we really, at this point, are recommending it essentially for people who we think may have had exposure, but it's never wrong to get the test. This is not a test that exposes you to any risk, but just keep in mind, if the test comes back positive and you didn't have any symptoms, you probably will need to follow up with a second test.
And Allison on here, who is the one that says she has the antibodies, we've already kind of talked about this, but she says she still wears a mask, still practices the social distancing. So we said it's not really your immunity pass, at least not yet, because we don't know exactly what it all means. We hope it provides obviously some immunity, but yeah, like you said, we're not sure about a lot of factors yet. Marla, I want to ask you a little bit as well. Just talk a little bit more about why we decided to offer the COVID-19 antibody testing. It makes sense for us to offer our screenings that we normally offer to 9 Health Fair at Quest Diagnostics. We want people to go get those preventive screenings like blood chemistry, your hemoglobin A1C for diabetes, but talk a little bit about why we wanted to offer the antibody test as well.
Yeah, we did think about it quite thoroughly, and our medical advisory committee, which is really comprised of some of the top doctors and minds here in Colorado. The reason we chose to offer the antibody test is because we think that we can help the community know a little bit more about the spread of the virus and where the hotspots might be, who's had it. It also, that convalescent plasma was a big consideration for us too, wanting to help people who are really sick. And if we can know who is eligible for that plasma donation, that was really attractive and a good reason to offer it. The other reason is, our goal and our mission always has been to put the power of prevention and health in the hands of the people. And so people really want to know about their risk. And so this is just one tool in the whole toolbox to understand your risk for getting COVID if you've had it, and what you can do about the other risk factors that you have. So we really want to encourage people to also find out about their diabetes risk and about their, heart disease risk and other things, because your overall health can really play a big factor in not only your risk for COVID, but also just your daily quality of life and living to the fullest. So that really is the reason that 9 Health wanted to offer the antibody test for all of Colorado.
And it really is convenience too. If you want to have your blood chemistry done and get all those 28 levels of information about your health, you can use that same blood. Quest will use that same blood to test the antibodies or anything else that you would like to. So it is a nice way to just get a one-stop and get everything you want done.
And I would just add to that, to what Marla said, is that it's not just a blood test. We're actually offering a comprehensive wellness and health assessment, because even after you get the blood test, 9Health has this fabulous program called 9Health Neighbors, where you can, talk to a medical professional for free, which rarely happens these days, and they'll call you back within 24 hours, which again is a tall order, because sometimes it takes weeks for me to connect with my doctor. And it's a great way for them to review your results with you on an individual basis and really help to, help you to understand how you can optimize your health and how you can use these numbers to really change the trajectory of your life, to change the trajectory of disease in your life.
Yeah, I was just looking up the number and the link. I'll put it in the comments, but it's 303-698-4455, extension 2005. You can call a 9Health neighbor and talk about any health question you have right now. If you have an antibody test question, a COVID question, or any just general health question, it's kind of a good way too. If you, like Dr. Coley said, don't want to reach out to your doctor yet, or your doctor's busy, or you just need to talk to someone quicker. And before you try to make any in-person appointments, you can talk to a 9Health neighbor, which is a 9Health medical volunteer, and get those answers. We did have someone ask, and this might be getting into the woods a little bit, Dr. Coley, but I want to ask this of you. Audrey said, if we don't know how the antibody response actually works in a naturally acquired infection, how are they testing the vaccine to make sure it's efficacious?
So, the antibody response to vaccines and to natural infection may not always be the same, but this week we've had results from 2 large vaccine trials. The first is the Moderna vaccine, that's the US vaccine, and then the second one is the Oxford vaccine. And the really great news is that both vaccine trials showed that people are making antibodies after 2 doses of the vaccine that are at a level similar to what they would be making if they had natural infection. They're the right type of antibodies. So they're these antibodies called neutralizing antibodies that actually inactivate the virus. And not only are they activating the antibody system in the immune system, which is called the humoral response system, but they're actually also activating the innate immune system, which is the second arm of the immune system, by activating cells called natural killer T cells. So these are kind of like your troops on the ground. These are the soldiers that fight the war. The antibodies are the markers that mark cells for inactivation or destruction, the cells that may be infected with the virus or the virus itself. So it's really promising so far that the vaccine seems to be stimulating not just the right type of antibodies, they're also probably stimulating enough antibodies similar to what you would get with natural infection. And they're stimulating the second arm of the immune system called the innate immune system. The questions that still remain that will really be answered in the phase 3 trial is, how long does this immunity last? Is this type of immunity with a vaccine effective at actually preventing infection? And of course, is it safe? When it's given to a larger number of patients, 30,000 patients, we will see those small safety signals emerge, will let us know whether it's safe. But so far in the phase 2 trials, it's looked very promising.
Yes, that's some good news, at least, that we keep hearing about this week. Marla, again, you had the antibody test done. We talked a little bit about your experience. Again, she had a negative test, but was just curious to see if she, would test positive. So that's why she got the test done. Any advice for somebody that wants to get their test done?
Well, I guess, from just a person on the street perspective, I really, it didn't change my behavior. I wasn't going to all of a sudden think that I had immunity, but it would have helped me understand that, okay, I had this virus, I can maybe donate plasma, or help the community understand that, how we're spreading it, because I'm very concerned really about the whole pandemic. I mean, we've been kind of in our homes now for months, and so how long is that going to last? And so anything I can do to help figure that out, our public health people figure that out, I wanted to do that. But I guess my advice is, I really did think that I had COVID-19. I mean, call me paranoid, but I really did think I had it. And so I had those symptoms. And so if you have those symptoms, it doesn't hurt to get tested and to find out for sure. Gave me a little bit of peace of mind in terms of, now I know I really didn't have it. And so, not that I would have gone running out to, bars and restaurants, but I certainly am very careful. I'm not doing any of that. at all. So it gives you more information, just one tool to help you understand how to go about life.
And one thing I would add is it's not just for the individual, but if Marla had come out positive and I was her physician, I may have advised anyone else living in her home to also get the antibody test, because we know that household contacts have a high risk of having co-infection together when they live together, cohabitate. So it doesn't just provide you information about our community in general and about your exposure, but potentially also the exposure of loved ones at home.
Right, and Marla talked about peace of mind. It is kind of a strange feeling because it'd be like peace of mind if you did have them, but then also peace of mind that, okay, I guess I wasn't that sick when I was sick, kind of thing. So it's
right. So if I had it, at least I recovered and I was, okay, that would give me peace of mind that way. And now that I know I didn't have it, it gives me peace of mind. Okay, that wasn't COVID, but I still have to be very cautious. So, and the other thing is, back in the day, when we're still learning every day new things about this virus, they were actually talking about, you could maybe pass it to your pets. So talking about households, my dog child was at risk, so I had to find out.
Right, gotta know for Koji, for sure. We did have someone comment on the Facebook page that it's really key to these other preventive tests that 9Health is offering. They help you understand how you stay healthy, not just increase resilience to COVID and the flu, other sicknesses, but also just enjoy your life more. So Dr. Coley, just talk about some of the other screenings that we are offering in addition to the antibody test and why it's important to get preventive screenings like that right now.
So I would say more than ever, actually, it's probably important to get your testing and preventive screenings done right now for several reasons. The first is a lot of the preventive tests actually modify your risk for either catching or having complications from COVID. So given this pandemic, it's really important to know right now what your risk is and try to understand it and hopefully try to modify it by changing lifestyle and, changing some of your risk factors. And then the second reason you really want to know is just because prevention is going to be the biggest casualty of this pandemic, because we've stopped going to doctors, we've stopped going to dentists, we've stopped, leaving our homes, exercising as much, going to gyms. We've stopped doing many of the things that prevent the diseases 10, 20, 30 years later. So I think more than ever, we really need to, especially knowing that this thing is going to be around for another 6 to 12 months, maybe even 2 years, we really need to reinvest our energy in focusing on prevention and making sure that if we had a COVID-19 weight gain and we gained weight, that it's not substantially altering our cardiovascular risk profile. So now is the time, and we've made the patient service center so safe that I feel very comfortable recommending all my patients to go there for their preventive screenings. And as a preventive cardiologist, in March, I was telling people, don't come to the office, don't go to the labs. But right now, we've done a nice job of figuring out, based on what we know about how the virus spreads, how to make this experience really safe, how to live alongside this virus and continue to really pursue some of those preventive screenings. So 9Health is offering a number of different screenings that you can take advantage of. The blood chemistry, I would absolutely strongly recommend. That includes not only your kidney function, your electrolytes, your acid-base balance, but it also includes your lipid parameters or your cholesterol. And that's really important for determining cardiovascular risk. There's a hemoglobin A1C that tells us whether or not you have glucose intolerance or prediabetes, or whether you have diabetes. Again, that can often be asymptomatic and sneak up on you. There's the high sensitivity C-reactive protein, which is a marker of inflammation that tells us about inflammation in your body, not just from the perspective of cardiovascular risk, but it can actually also predict risk for cancers, for autoimmune conditions, for a number of other diseases as well. And then blood type, we've heard about the relationship between blood type and COVID. So blood type's always an important test to know. You can also get a sense of your iron levels, your vitamin B12, your vitamin D, a lot of the vitamins that are involved in immune function and can help protect you against COVID.
Yeah, and again, that's 9healthfair.org, and you can go there. I put the direct link to the page with all the screenings in the comments. So you can click that and go and see everything that we're offering right now and try to live your healthiest life. I kind of wanted to wrap up here, but someone did ask a question that I want to clarify because I feel like it is one of those ones that people keep saying. Brianna said antibody testing is not effective. It can detect antibodies from any form of coronaviruses, including the one that causes the common cold. We've talked about this before, but maybe just reiterate what the answer to that question.
So actually, that's not entirely true. So yes, you're right that antibodies to other coronaviruses could be existing in our system, but the antibody tests that are on the market, specifically the one being offered by 9Health Fair, is actually very specific to the spike protein, which is special just for the SARS-CoV-2 virus. So that's just this type of coronavirus, and it doesn't exist in the other coronaviruses. And the antibody was specifically and intentionally designed that way in order to really be reacting to that spike protein so that we're not having cross reactivity with a cold that you may have had last year or something like that. So rest assured that, again, that specificity number, which tells us about false positives, like you could be a false positive because it's cross reacting to a coronavirus from last year, is only 1% with the test that 9Health is offering.
Right. Then we went with Quest Diagnostics because their test is pretty accurate. So again, you can go online, 9healthfair.org, choose the screenings that you want. One of them is the antibody test. There's a lot of other preventive screenings. Dr. Coley mentioned that it's looking for that spike protein, the antibody test, which is that kind of scary ball thing with the spikes that we keep seeing an image of. That's all I think of when she says spike protein, is that little ball with the little triangular spikes on it, the COVID-19 little virus ball thing. So that's what it's looking for. That's my technical terms. So again, 9healthfair.org, links in the comments. There's 35 Quest patient service centers participating around the state. Most of them are metro area. If you aren't near one, you can also get a kit to use at home, but it won't have the COVID-19 antibody test. You can do those preventive screenings, but with 9Health at home, you can't do the antibody test. And again, Dr. Coley mentioned 9Health neighbors. Once you get your results from your screenings, you can talk them over with a 9Health neighbor. Our 9Health medical volunteers are staffing that. A medical professional will call you back within 24 hours. The number is 303-698-4455, extension 2005. I put it in the comments. So you can call right now with any health question. You can call with your results to discuss those. But they're really just our medical volunteers that we usually use at the Spring 9 Health Fairs. Needed something to do, so we're using them for this 9Health Neighbors line to answer all your health questions, and we're very thankful for them doing that. I don't see any other questions to ask right now, but if you have any additional ones you want to ask, you can put them in the comments, and I'll pass them along to Dr. Coley or Marla. She talks about her experience getting the antibody test, which I hope was helpful. Again, just a simple blood test. But yeah, that's it. I'm going to wrap this up and let these ladies go. Thanks so much for joining me.